Do you want to know just how to duplicate your patient's denture? Today, I'm going to show you a quick video on the records we need here at the lab to make your patient a duplicate denture. The first piece of information we're going to need is a 360 scan of your patient's denture. You can go ahead and utilize your iOS for this scan and go ahead and start on the tooth surface. We're going to scan the full arch all the way across, capturing all the teeth and starting to capture some of the acrylic on the denture itself. And it's really important that you capture the 360 scan in one scan so that we aren't stitching data together here at the lab. We want to make sure we get the intaglio side of the denture as well as the cameo side when we're doing this scan, all in one piece of data. Once you've captured your 360 denture scan, we then want an opposing and a bite if we are going to make any changes to the patient's denture. So if you want us to change the wear and tear on the teeth, increase the patient's VDO, we need you to go ahead and capture an opposing and a bite with your iOS scanner and the old denture in place. Or if you're looking to improve the fit on the denture but keep the wear and tear the same, we just need that 360 scan of the denture. Sometimes with certain iOS systems, it can be a little bit tricky to pick up the inner surface of the denture as it's a little bit shinier, as we all know. So what you can do before capturing your 360 scan, if you were having difficulty, is take a wash inside the patient's denture. We like to recommend a blue mousse material, but whatever material of your preference you'd like to use, it can help cover that shiny palatal aspect so that you can take your 360 scans and send it to Row. It sounds too good to be true, so I'll walk through it one more time. If you're making changes to the patient's wear and tear on the teeth, we need a 360 of the denture, an opposing scan, and a bite. If you're not making any changes, we just need a 360 scan of the denture. And lastly, if you want to change the fit but not the teeth, we just need a wash impression on that denture before your 360 scan. And if it still sounds too good to be true, feel free to call into our lab and one of our technicians is happy to walk you through a checklist of all the things we just talked about need so that you can make sure you don't have to bring the patient back and we have all the data we need to fabricate your duplicate denture here at Row. Feel free to like and follow us on our social media platforms for more helpful videos like this. Thank you so much for tuning in and we look forward to duplicating your patient's denture.